Well, it's extremely important for me to be part of this type of community program. It's because we actually need to be very proactive in ensuring that we are getting out education and knowledge, and as well as treatments for patients and people who actually are needing great impact in their health. Being that I've been a family physician for many years now, I really do believe how important it is for us to have strong education, strong advocacy, as well as strong prevention. We actually do not have enough, to be frankly honest. After treating so many patients for so many years, I noticed that if we don't get people knowledgeable about what it is that's out and available for them for resources on how to become healthier and how to be stronger and how to prevent disease, then we're really losing the battle against the disease. And being that lung cancer is an extremely serious condition for so many, and my heart has gone out to so many who have been affected by this, I believe we need to be very proactive in giving patients and giving people education about what is important to prevent the disease as well as to treat and to support. I'll never forget that I actually have had the honor of treating so many patients, but I have two patients that were really affected by lung cancer, and I'll never forget them. One was an actual patient who actually had lung cancer as a result of secondhand smoke. And that was something that was very heartfelt for me because this person loved and lived with a family loved one who had actually was exposing them to secondhand smoke, and that contributed to her lung cancer development. But she was able to fight it and she was able to overcome it. So I'm very grateful to have known that. Another patient I had lung cancer, and that patient unfortunately ended up having to have surgery to remove the lung cancer but continued to smoke. And that was very disheartening for me because I know that how important it was for the patient to stop smoking, and my heart really went out to the challenges there is with addiction. And I know that nicotine is a very addictive product. So having the opportunity to be part of the Hill Collaborative and be an actual participant as well as a actual um, engager in this particular type of forum is important because we need to get the information out. We need to support and we need to advocate and we need to also to just collaborate and coming together to improve health statistics and make better quality lives for most and all. Well, the number one misconception that is related directly only to smoking. There's other things that can actually cause lung cancer, as many know, and some may not know. But lung cancer can be caused by exposure, and exposure in in the communities, in various waste areas, and also to in the environment, in the air, and as well as chemicals that are out in the environment, as well as chemicals that are actually being in certain communities that have been directly impacted by statistical health problems as well as lung cancer is a prevalent issue that we need to really seriously address. And having exposure to radon is a major issue when it comes to potential risk for developing lung disease as well as lung cancer. Um, I think the misconception also too with lung cancer is that it's actually something that is not treatable. And that's another major problem. And I believe with the Hill Collaborative, as well as other organizations that really advocate for education, can help curb the tide of not only educating people about the risk for smoking, but also to the risk of developing cancer, as well as the benefit of treating cancer when it's caught early. So early prevention, early intervention is so critical. So I think when we advocate for that and educate people about how important it is to get early prevention, early screenings, early intervention, it will help save lives. Well, what I would advise someone to do is to be very, very proactive and value of yourself. It's very important for a person to know that they are a gift and that their life is precious and that they have a gift of life that is to be used and to be actually a proponent for the good in the earth and to be an actual positioning in the earth to be able to love and serve and give. And so you can only do that when you have good health. So when you have good health, you are able to fulfill the promises that you have and the goals that you have. So really starting with valuing yourself, also to seeking a very good primary care physician And I'm not just saying that because I am one, but I am saying that because it's very important. Primary care is the crux of our healthcare system and actually the healthcare community. So I believe that people should always have a primary care physician that they go to every year for their physicals. Because when a person comes in for their physicals, they're able to be very, very earnest in getting preventive screenings as well as health maintenance. And preventive screenings will allow persons to catch disease processes early, as well as to get intervention and treatment early. And in regards to health maintenance, if a person comes in to get their physicals every year with their primary care doctor, they're able to continue with better health because our health is truly our wealth. My biggest aha was the survival rates associated with early treatment and treatment with combined therapies or combined treatments of chemotherapy, immunotherapy, and radiation. That was extremely powerful for me because when you actually see patients who have had cancer in the years that I have practiced in the past, we did not have these advances as we do now to help improve treatments and also to improve outcomes and help people live longer lives and healthier lives and even beat cancer. So I was just completely excited to know that we can actually beat cancer at higher numbers with early intervention of these wonderful treatments.